Happy Wednesday evening. I'm your host, Shameika Rhymes, and welcome to Soulibration. Let me know where you're watching from, and hopefully you're in a safe location and well out of, the wrath of Milton. I know that it's impacting Florida heavily right now, so I hope you guys are all safe. But let me know where you're watching from, and if you have any questions, make sure you drop it in the chat. As we go along throughout the show, we'll pull the questions and have the doctor answer those. And remember to share this with your network because you never know who could find something valuable in it, right? So last week we talked about menopause since October is Menopause Awareness Month. And so many of you had questions about symptoms such as hot flashes and weight gain. So we're going to talk about it today. I had to bring the doctor back for a part two. So in this episode, we're going to continue that conversation on menopause. We're going to focus on how to manage those often overwhelming symptoms of menopause using a more natural, holistic approach, from sleep problems to anxiety. Again, I mentioned weight gain earlier, brain fog, being moody Judy, all the things. We all face so many different symptoms as we enter this new chapter of life. And as you heard Dr. Matur say last week, that can start sometimes as early as in your 20s. Goodness. So she's back she's a leading menopause specialist. She's back with us tonight, and she's going to break down how bioidentical hormone replacement therapy and other holistic treatments can offer some symptom relief. So drop in the chat what kind of symptoms you're having so we can kind of touch on those. So let me introduce the doctor tonight, Dr. Anju Matur. She's a holistic and functional medicine practitioner at her Angel Longevity Medical Center in Los Angeles. Hello, doctor.
Hello, Shameika. I'm very happy to be back and answer more questions.
Yes, I'm so glad you could come back. So I thought this week we would take a deeper dive into some of these symptoms because I noticed that the biggest question in the chat last week was about hot flashes. Let's kick this off with, can you explain what a hot flash is and what it feels like? I know what it feels like to me because sometimes I see people asking, is this a hot flash or am I getting sick or what's going on?
Yeah. I mean, there's a big difference between being sick and getting a hot flash. Since it is hot and it's flash, it is heat that you feel like you can have a feeling of heat either throughout your body or just in your face. And it can come and it can go out in a flash. And that's what it is. So you can get it every 15 minutes. You can get it every hour. You can get once a day. You can get it twice a day. You can get during the night. You can wake up with a hot flash. So there's different scenarios that could happen to you. I remember a patient that first came to see me, and she was the only patient that I saw that came in, and she brought a fan that was around her neck.
I do have one of those.
And I said, Margie, what is it? She says, Doctor, I'm so hot. I can't live without. And she was living with that fan around her neck for I don't know how many years before she came to see me. And of course, now she's fan free and also hot flashes free. And so it's very, very common. And you can get hot flashes. Very few people may not have any hot flash, even if they're going through menopause. So it is very individual in experience of menopause. And the reason now, why do we get the hot flash? Would you want to know that?
Absolutely. I want to know about that and night sweats.
Yeah. So basically, these are called vasomotor symptoms. And that means that they are coming from the blood vessels. So they're vasomotor. So that the problem is that the blood vessels that are close to your skin, they dilate suddenly out of nowhere. They dilate. So you feel like you have a fever, right? So it's like a hot heat. And then they go back to their normal position. So that's when you get a flash. And that's just because of the vasomotor, because of the blood vessels, the vascular sensitivity is changed. So that's when you kind of dilate and you can go back, contract again, dilate and contract. But the reason that you have that is some people believe, or it was believed, that is because of the estrogen deficiency. But there is many studies that have shown that the actual problem comes from a hormone called FSH, which is a follicle stimulating hormone that gets released from the pituitary gland, and the fluctuations of the FSH is what causes the vasomotor symptoms of menopause. So, but the reason why your follicle stimulating hormone or FSH will go up and down is from the fluctuating levels of estrogen.
Oh, okay.
Yeah. So if your estrogen is fluctuating, it affects the FSH, and that will change your sensitivity of your blood vessels. So the muscles that are in the blood vessels that dilate or contract the blood vessel is what is under the impact of the changing hormone levels.
Okay. So with that, I've heard some people say they are triggered by hot flashes. And let me know in the chat, like what triggers your hot flashes. For example, I know one of my triggers is alcohol. You know,
Yeah.
I can't, like, it's not my friend anymore.
Yeah.
Or it's stress. If there are certain people that will trigger that hot flash.
Yeah.
And I know
Yeah.
I can't talk to them. So what so why are there certain, what are triggers? Like is there like a common trigger, or is it just kind of depends on the individual?
Yeah, like I said, there is a vasomotor sensitivity that has changed.
Okay.
So when you're younger, the blood vessel, the smooth muscle
Hmm.
that is in the blood vessel wall, that is very sensitive to anything that's changing, and especially to the changing hormone levels. But there could be external triggers. I mean, people sometimes when they talk to someone they don't like, they could break out into a sweat. I mean, this is very common, right?
Yeah.
So yeah, so there is many triggers that could be. I mean, even coming into a cold room or
Hmm.
a hot room can trigger a hot flash. Or if you are very tired, it could also trigger a hot flash. I mean, it's not so much important to find out what the triggers are, and I
Okay.
mean, I guess it could be, but to
Hmm.
really be in control of your hot flashes, you need to handle your hormone levels. so if you handle your hormone levels and they're not fluctuating, then you would not have a problem.
Okay. That
Yeah.
makes sense. Um, so the night would the night sweats kind of be the same thing as to
Yeah.
what
Yeah.
causes those to occur as well?
Yeah, same thing. Is a vasomotor sensitivity. So you could just have in the skin if it is the blood vessels
Hmm.
or the sweat glands. They are all under the impact of the hormone levels, and so that's when you can get that. I mean, if you have fever,
Hmm.
you get the heat, and then after that you can break out into a sweat when you come down from the fever. So the same thing is the same phenomena, same physiology is happening. When the body temperature goes up suddenly, then when it stops, then you get the sweats. So the sweats follow the hot flashes most of the time. Sometimes the person doesn't feel the hot flash, but they get the night sweats. So
Mm.
it's very individualized. People can experience either way. They could experience menopause either way. I mean, I have several patients that would the only problem they had was the night sweats, that
Hmm.
they would in the nighttime they would sweat and they would have to be completely drenched and they have to change their PJs and go back again to sleep. Or some people have hot flashes and night sweats. Sometimes your sweats are so much you don't even notice a hot flash.
Yeah,
Because
yeah, I feel, I mean, I've had that experience of the hot flash and the night sweats, but thankfully I don't, knock on wood, don't have that problem right now. So
that's really
it's
good.
rough.
Yeah,
Yeah.
it's rough. I mean, it interrupts the sleep. And I think there is in modern times with the modern diets
Hmm.
and what we are eating affects a lot of how the blood vessels and even just with the entire body how it works.
Hmm.
Because I mean, my mom, if I think about my mother, she didn't have hot flashes. She never had night sweats, and I was always wondering like why. So I realized that because she was eating so much herbs, and we were vegetarian as I was growing up,
Hmm.
and so we always had she cooked food with so many herbs, and turmeric spice is like the common in India. So any food that you make has tons of turmeric, and turmeric has so many physiological effects in the body
Hmm.
that it's amazing. Like from one end, from anti-inflammation, it's even it's a kind of even a painkiller. It can reduce the pain because of reducing the inflammation. So there's many things that you could do or could be doing that would affect your hot flash.
Hmm. Okay. And I remember in the chat last week, a lot of people were asking how they could relieve those symptoms. You already mentioned like balancing those hormones, but is there anything else if they don't want to do HRT or be HRT? Is there something else they could look at doing that's more
Yeah,
holistic and natural?
for sure, for sure. Like I mentioned, some of the herbs. I mean, number one, even though black cohosh is very common, people know
Hmm.
about black cohosh. But if you really look at the studies, it doesn't really change that much to the hot flash.
Hmm.
It's really a very important herb for depression, because hot flash, you feel the hot flash, it goes away. But the depression that people go through when they get into menopause is pretty significant.
Hmm.
So lowering or the reduce the declining of the estrogen hormones is linked to depression. So you have black cohosh that can help you with those symptoms, and some people with the hot flash will go away as well. But the major physiological effect of black cohosh is handling the depression in women. So that's just one of the things. And then you can do other things like soya isoflavones. Those are very powerful, and they actually act like estrogen in the human body as well, because they do bind to the estrogen receptors. So you can have similar effect, but it's not going to be as potent.
Okay.
I have to tell you, because look, I don't know if I did this last time. I have created a product,
Hmm.
and it is called MENOPRO, which is basically menopause, and pro stands for probiotics. But and I put a lot of herbs there to help women that are out there. They are not they are not able to see a doctor for whatever reason, functional medicine doctor or bioidentical hormone replacement specialist. And I thought maybe I'll help people and understand and maybe get better and all this. So it does work, but it's not as potent as it would be if you balance your hormones.
Okay. Are there any particular lifestyle factors like diet, sleep, exercise that can help reduce the severity of menopause symptoms?
Yeah, absolutely. I think it's a lot to do with lifestyle. I
Hmm.
feel like the women have more extreme menopause symptoms only because their lifestyle is so terrible. And one of the factors, like I started to talk about it, was a diet.
Hmm.
So if you are eating food that's full of chemicals, that is like pesticides, insecticides, sprayed produce, or you are having any kind of artificial flavors that are all chemicals, and even like artificial hormones, because the animals are actually injected with growth hormone, for example, and then to grow them bigger and plumper and all this. So they have very bad effect on the human body. So that those things, if you eliminate those things from your food, even like drinking, I'm sorry to say, but soda. I mean, it's
Oh,
so
yeah.
common. People drink sodas every day.
Hmm.
I mean, that is totally a chemical substance. There's nothing natural in there. So so that's one thing that you can eliminate immediately from your diet. Energy drinks, for example, caffeinated, there's so much caffeine, people are drinking so much coffee because of menopause related. It could also be menopause related, that you have no more energy, no, don't have enough energy. So people say, oh, pick me up, and they drink the energy
Oh,
drinks.
yeah. Yeah.
That is not a good thing to do to your body, because again, there's humongous amounts of added sugars in those drinks. And then you have, or even if it is sugar free, right,
Hmm.
they are putting artificial sweeteners there. I mean, they're substituting whatever they say free, they're substituting that with something else. And you have to really look at it carefully, that you don't want to put something in your body that's not natural and it's not organic. So you have to be very careful, especially when you get into menopause. You don't have a lot of room for
Hmm.
error.
Gotcha.
When you're young, when you're younger, you can take the abuse, right? People
Hmm.
drink sodas every single day and they
Oh,
have no
yeah.
problem, right? But when you get to menopausal age, you don't have a lot of room for error. So you have to make sure that you take good care of yourself, and even exercising. So if you go for a walk or you go for running, even 10 minutes, 15 minutes a day, that will pump some of the hormones. Absolutely. For example, testosterone.
Oh.
You could do
Hmm.
that. You could actually run and lift weights or do weight training and things like that, that would help. Not to a big extent to a perfect physiological balance, but it will improve.
Okay. Well, how
Yeah.
do you determine whether a woman's menopausal symptoms require treatment, like if they need hormone replacement, or if their lifestyle changes could just be enough to manage the symptoms?
Okay, that's a very interesting question. In fact, when I got into alternative medicine, I was doing normal family medicine before,
Hmm.
and then I experienced myself perimenopausal symptoms, and so I said, okay, let me see what would help to improve this, because obviously there was no answer in the mainstream medicine.
Hmm.
All my tests were normal, so there was like everything is good, but I didn't feel well, I didn't sleep well, and didn't have enough energy, and all these things that people go through. So the first thing I did was to find out what should I be eating. Believe it or not, they don't teach you about nutrition more than 2 hours in a medical school.
Oh, wow.
Yeah. So the only thing I knew was the ADA diet, the anti-diabetic diet is the only diet I knew of, and there was no other diet that I knew. So, so the first thing I thought, okay, let me see what is the right food for me. Not what the food is correct for everyone else, but what is the right food for my body.
Hmm.
So I started researching that to find out, okay, how do I figure that out? And I did. And I introduced that diet to my patients once I found out that it works. And you have to find out what exactly is your metabolism like. So finding out what is your metabolism, what dominates your metabolism, and how does your body really react to the food that you are putting in it,
Hmm.
that solved the problem to a certain extent. So I did that for almost a year and a half, and I did nothing else, just that for 1.5 years. and
Hmm.
i and I realized that I was better. For sure, I was better, I felt better, and I wanted to stick with it because it was working to a certain extent. But if I were to give a number, like what percent improvement that I experienced,
Hmm.
I would say roughly about 35%.
Okay.
So, like a third of my symptoms were improved because of the diet, right?
That makes
But
sense. Yeah.
yeah, but then I realized, okay, that's not enough for me. I am, I want to be perfect. I want to do the best I can and all that. So I continued my research to figure out, okay, what's the next thing I could do for myself and for my patients. And believe it or not, it was not hormone replacement
Hmm.
therapy. It was actually immune boosting therapies.
Oh.
So, yeah, believe it or not, that's the other thing. So I said, okay, so with aging, I think the biggest uh, systems that is being affected in the body is immune system,
Hmm.
because even hormones, all the hormones supports the immune system. Believe it or not, they all support the immune system. Going from adrenal, ovarian, thyroid, pituitary, all these hormones are actually affecting the immune system. So if when your hormones decline, your immune system is declining at the same time. So this is why there is more problems with heart disease, with cancer, even, right? And dementia. All these things are connected with immune system, because immune system is what is causing anti-inflammation.
Hmm.
So when you are getting older, you get more and more inflammation, and that's what causes the degenerative conditions of aging, right?
Hmm.
So if you can improve that, you will feel better 100%. So I introduced those treatments in my practice, and we do a lot of those. So then I started feeling better, and I said,
Hmm.
okay, so this is good. And then I did that for probably another year or so. I did that for a year for myself and for my patients, and I said, okay, this is good. I feel better, but not quite, right?
Uh-oh. Okay.
And since being a high achiever, I'm like, okay, I have to do something even more than this. So if I were to give you another number to it, I would say about 30%
Okay.
improvement. So overall, I went all the way to 60%, let's say,
Hmm.
60%. And so I said, okay, that's good, but I'm not feeling like when I was 30 years old, right?
Right.
I said, okay, so I have to do. So the last thing I put in there was bioidentical hormone replacement therapy. And
Okay.
that's when I got started. And I said, okay, so And the other thing you have to know is that menopause doesn't necessarily only means female hormones.
Mm-hmm.
It doesn't mean that it's only declining female hormones that are causing all the problems. The whole endocrine system is getting older. So it's not producing as much hormone as it's supposed to.
That makes so much sense. Well, can you explain? I want to go back to when you said the immune boosting. What exactly did you do, and what can we do at home? How do I boost my immune system? I take zinc daily. What else can I do?
Well, we have obviously a medical clinic, right? So people
Yeah.
come here and we do the treatments. But what I introduced at that time was vitamin C IV drips.
Okay.
Yeah, so you can
Mm-hmm.
do IV vitamin C drips, which I had never heard of in medical school, right?
Mm-hmm.
And I had to learn all this on my own and from other resources. I mean, Linus Pauling's research was amazing. He got a Nobel Prize for that, for discovering vitamin C. And he himself used to get vitamin C drip once a week, and he would take oral vitamin C.
Mm-hmm.
So being at home, I think the minimum you can do for yourself is take vitamin C to bowel tolerance. So people don't know what that means, and they don't know how much to take. The biggest commonest problem that I see people kind of trying to figure it out, how much should I be taking?
Mm-hmm.
So in general, the rule is what's called bowel tolerance, which means you take as much vitamin C as you can tolerate until your bowels get looser.
Oh, okay.
Yeah,
Okay.
once your bowel get looser, that means the body is not going to tolerate after that. So you cut back slightly to get, the bowels to act normally. So we're not getting a loose stools. And
Okay.
that's the right dose for you. Now, that dose can also change from
Mm-hmm.
time to time depending on whether or not you need more vitamin C. For example, if you were coming down with something, if you're feeling sick for whatever reason, your body needs more vitamin C. So when you're sick, you can tolerate all the way up to 10,000 milligrams a day.
Mm-hmm.
And when you're not sick, you probably need, let's say, 2,000 a day. So that itself can change.
Okay. You're teaching me new things tonight, Doctor. Everybody, I want to remind you, if you have questions, please drop them in the chat. This is so interesting. And you mentioned depression earlier, of how it gets, for some, it gets worse. For some, it's maybe anxiety or something they've never really experienced before. So, what role do stress and mental health play in exasperating those symptoms? And are there any holistic strategies to manage that?
I think, to put it simply, right?
Hmm.
Because you're right, the women through menopause, perimenopause, even get anxiety, panic attacks as early as early 30s. I've seen
Hmm.
people who come to my office and they ask me for help because of their panic attacks, right?
Yep.
And
Hmm.
they end up in the ER every other day or whatever, and they
Oh
get put on the
goodness.
Xanax and whatnot, right?
Hmm.
So the issue is not the Xanax, the lack of Xanax, right? So the issue is there is a lack of something. The body is requiring something that it doesn't have,
Hmm.
and so it is throwing a panic attack, right? I'm
Oh,
talking only from the viewpoint of hormones. Of course,
yeah.
there's other things in the body and there's other things in the environment that could cause depression. If you're connected with someone that is antagonistic to you, you are going to feel like, oh gosh, stressed out, right?
Right. Right.
And you are panicking. So that's obviously there. And you have to
Hmm.
identify those situations and handle them one way or another. You should handle them, because even if you take the hormones and you have problem with life situation with another person or a family member or friend or a coworker or boss or whatever it is, right?
Hmm.
That could be causing your anxiety. So when I'm treating patients, I am always looking at all the factors that could go and play a role in this person's presentation, their clinical symptoms and what they're experiencing. So, I mean, it's all good to talk about hormones, but on the other hand, I've also seen patients who get put on antidepressants for menopausal symptoms, because one of
Yeah.
the, so they may not have any other symptom, they have just depression, for example.
Mm-hmm.
They have no hot flashes, they have no other things, or even if they do have things or not have things, and the doctor telling them to tough it up,
Yeah. Yeah.
right?
Can we
And
can we
that's
can I pause right there for a second because I want to, just before I forget. Um I've noticed had a lot of women bring that up, and because I'm on my podcast, Ladies Edition, where I've had that same experience where a doctor will say, "Oh, here's some antidepressants," without getting to the root cause. So go ahead. I'm sorry. I just wanted to
no,
address
totally.
that because I don't know how we respond when a doctor does that.
Yeah, I mean, that's very legitimate question, and I get that very, very frequently.
Hmm.
And so, but we say obviously the lack of anti-anxiety pills is not the reason you're getting anxiety. That's the first thing you have to understand, that this is
Yeah.
not because you don't have Xanax in your system
Hmm.
that you have anxiety. So you have to find out what is the reason that you have anxiety, right? If it is physiological, like I
Hmm.
said, if it is physiological, it's body related and medical related, okay, you need to find out what is causing it. So to give you a clue, it's very common for people who have progesterone deficiency to experience panic attacks.
Okay.
Very
That's
common. I mean, I
interesting.
get this frequently, and I treat them with that, and then lo and behold, the panic goes away and stays away. There is no problem, and
Hmm.
then the next step for me personally is to get them off of the Xanax, because Xanax and other drugs like it are very addictive.
Hmm.
They are
Hmm.
very addictive. Once you get on them, it's hard to get off because you get withdrawal effects.
Oh, wow. Okay.
So one of the side effects of these drugs is anxiety and depression. So if you try to go come off of it, you get more anxiety and more depression.
Hmm.
So that's kind of a situation where I have to deal with, and I have to get them off safely without going into another panic attack. So that's just this is what I like doing it. I have fun with it, and I most of the time I would say 80 to 90% of the time we get people off of those drugs forever. They never want to go back on those, and so
Hmm.
that's it's very satisfying to me when I see that, because now they're not dependent on a drug. Plus, it's not like the drug really handles their problem. It doesn't.
Oh, that's a good point.
Yeah, it's not
Yeah.
like your drug actually handle your anxiety or depression. It didn't do that.
Hmm.
It just kind of dumbed you down. It's like not complaining about it, but you don't feel well internally,
Hmm.
because it does change your mental status, right? And
Right.
people become more like numb. They become numb. They don't feel anything. So it doesn't mean that you're living your life for full at the full capacity that you can. You are mainly being dumbed down, and you're more like becoming numb to it.
Hmm.
Instead of having fun and enjoying life and doing what you really want to do, it becomes like, okay, it's just like a somebody else is playing a movie sort of thing of your life, right?
Yeah. Wow. Okay. Guys, don't forget, drop your questions in the chat. So, how do you help your patients? Because you mentioned it could be some other things, or it could be menopausal symptoms. So, how do you help your patients differentiate between what's menopausal symptoms and what is some other health condition?
No, obviously you want to get the detailed history. You want to
Hmm.
find out what else is going on and if they've had previous problems. I mean, there's many, many things that could go into it. But overall, one has to understand that the biggest thing that one has to understand is that it's not the lack of the drugs that's causing your symptoms. That's the
Hmm.
first step to understand. And from there, you can make a list what is happening. Like I said, if you have someone in your life that you're causing trouble for you, then you're going to be have anxiety and panic attacks. It's very
Hmm.
simple. So we then handle that problem. So
Hmm.
I mean, we do holistic medicine. Looking at we are looking at the whole entire person and their life. What are they doing? Every
Hmm.
person, what how they affect each other, because people do influence each other.
Very true. Um, Ned, have you heard of some different myths about menopause and its symptoms? And how can you tell women or warn women that that's not really true? You should see your doctor. Are there any myths that this come to mind?
Um, You mean something that's a myth? It's not real?
Yeah.
Okay. Well, I can tell you one. I don't know if it's a myth, but it is one that people think, oh, the menopause is just like it goes away. They tell
Hmm.
me it just is temporary problem, and once it goes away, it's gone and it's all good. I don't
Hmm.
need the hormones. That's what sometimes patients say. So I think that's a myth because we are not treating particularly your hot flashes
Hmm.
or your night sweats because they could be temporary. But the reason why we want to balance your hormones is because we want to prevent age related degenerative disorders. I don't know
Hmm.
if I mentioned it last time, but it's basically starts from your head, your brain. So dementia, Alzheimer's, anxiety, depression, insomnia, all of these things could be related to your hormone deficiencies. So you may not have hot flashes, but you may have depression, or you may have anxiety, or may have insomnia, other things. So we want to prevent that. I'm not
Yeah.
saying everybody, all Alzheimer's patients could be prevented, but I think majority of them could be prevented. So if you balance your hormones, you don't, at least you take that variable away. That's not the reason of your Alzheimer's. I mean, there could be other reasons, but that's not the reason. So we want to take away that reason of hormone deficiency causing dementia or Alzheimer's disease. So that's one thing. The other thing is the heart. The risk of getting heart attack and a stroke increases in women right at menopause and after. That
Wow.
means you, if you were premenopausal, that means you were having a period, you are protected. That means you're not going to get heart attacks and stroke to that extent unless there was genetic factors or other reasons. You would be at a lower risk for getting a heart attack or a stroke as compared to a man same age. But as soon as you reach menopause and the hormones are withdrawn from the body, your risk of getting a heart attack or a stroke is higher than a man same age. So if you were 50-year-old and you stopped having your periods and you're getting hot flashes, you are immediately a risk of getting a heart disease increases more than a guy who is 50-year-old, and not, and you are in menopause. So that's really what it is. So I want to prevent that. So
Hmm.
number one killer in postmenopause women is heart attack, is not breast cancer. People are afraid of breast cancer, but it's not the number one killer. It's the heart disease, which women are not aware of. They don't think about getting a heart attack,
Yeah.
but that's the reason why they lose their lives after menopause, is because of withdrawal of hormones. So I can't claim that if you do hormones, you're not gonna never gonna get a heart attack. That's not true, but
Hmm.
it reduces the risk of getting a heart attack or a stroke. So that's important to me
Hmm.
because I don't want people to die prematurely because of this simple issue of hormone imbalance. We can do that very easily nowadays. So why don't we do that? And so that's really important. So I do that for that reason. I'm not treating
Hmm.
just the hot flashes. Hot flashes, like some people think, it's a temporary problem
Hmm.
that is not going to last forever. Even though I do have women who are like 80 years old and still getting hot flashes.
No.
So it's not common. It's not common, but it can happen. And the myth about it's temporary, I think it's a myth because it's not the reason you should be doing hormone balancing. It's to
Hmm.
prevent even of course osteoporosis, right? When the hormones get withdrawn in the female body, you are at higher risk for getting the osteoporosis. And that's another reason why you would lose your life, is because you were so weak that you fell over, you broke your hip, and then that's it. That's how people lose their lives at the end of their
Yeah.
lives, because they of the osteoporosis. So I want to prevent those problems
Hmm.
in women, and this is why I want to do the bioidentical hormone replacement therapy, and not just for a temporary fix of, okay, let's just get rid of the hot flashes.
Okay. We have a couple of questions. Let's see. Tamika Smith says, how can someone discuss their experience with menopause while dating and communicate effectively with their partner? Do you get that question a lot? Like,
I
how do I
think
tell this person I'm going through menopause?
I don't know. I guess it's all about communication. You can communicate what's happening,
Hmm.
and just give them more information that this is what's happening, because a guy may not understand. But here's the thing: the truth of the matter is this. This is a myth that people think, oh, guys don't have any problems with the hormones, declining hormones, or sudden symptoms like menopausal symptom, right? But
Hmm.
that's not true, because men also get hot flashes. They do get night sweats. I get men every single day that complain about that. So I don't know. I think men are more aware as well nowadays. They're coming up and they're understanding what the menopause is. So if you start to speak about it, then there's a chance that the person will understand. I guess if you don't talk, then nobody will understand what's happening.
Yeah. Yeah. Just tell him it's too hot. Don't touch me. And then he'll say, oh, yeah, you're right. It's too hot.
No, just get a fan. Just get a fan.
Just get a fan. Y'all can both just stand there in front of the freezer.
Or find a bioidentical hormone doctor that can
Yeah.
help you.
She also had another question. She says, aside from herbs, what are some of the best foods for managing menopause symptoms and supporting the immune system?
Well, the common thing that you could do, easy thing you could do, is the soya beans, right?
Hmm.
The soya isoflavones are like estrogen. They do act like estrogen in the body. They do bind to the same receptors. So if you were to, I guess, eat more soya beans, but make sure it's organic, that
Hmm.
it's not GMO'd, because that's not going to help you. You want yeah, you want more like organic and non-GMO soybeans. That will help. I think that will
Hmm.
help. And then rest of it is just normal, like turmeric will help. I think the turmeric will help a lot. Garlic, ginger, all these things will cause less inflammation, and it will just, you will feel better if you do that.
Okay. The biggest question, well, I know I've had this question. How do you get rid of that belly fat that just seems to just attach itself to you once you start having those menopausal symptoms? And it's just always, that right around the waist. What causes that and how do we get rid of it?
Yeah, well, that definitely is part of growing older. So your hormones are declining, and that will cause belly fat. Uh, but what I have seen is this. I guess 50% of my patients, once I balance the hormones, they usually drop the weight on their own. That I
Mm-hmm.
never have to do anything more than just balancing their hormones. So if you balance your hormones, your belly fat should come off more easily. Like
Mm-hmm.
I had, I'm just thinking of a patient that came in, and I think I mentioned her before. She was feeling really interesting symptom was like she was feeling like she was encased in a barbed wire. That was representing symptom. And she said she
Oh.
was like so prickly, heating and prickly kind of sensation throughout her skin, and that
Mm-hmm.
was the biggest issue she had. So we said, okay, so we started treating her, balance her hormones amongst other things. And then by the time I finished with her, she was so skinny. And I was like, oh my, are you okay? She says, yeah, doctor, I used to be like this when I was 16 years old.
Wow.
So this is perfect for me. And I'm like, okay, as long as you don't disappear, I'm
Yeah.
happy.
Uh, um, so since you mentioned the skin, how does menopause affect our skin and I know we mentioned hair in part one last week, but we didn't really get into the skin issues. I noticed with me, um, my skin seems to be more sensitive. I could look at something or walk outside and I'm breaking out in the hives, or I've had acne as if I'm a teenager again. So, what other ways can it affect the skin, and how can that be? Is that another? Um, do you have to get on hormone therapy to be able to balance that as well, or is there some other way to fix those skin issues?
Well, obviously, it's not just one thing that's being affected, right? The
Mhm.
hormones affect every part of the body from top to the bottom. Every
Mhm.
part of the body is being affected. To what extent is different in different people.
Yeah.
Like I mentioned, this patient, her main problem was she was in a barbed wire. Like her skin was so sensitive, and she was like, somebody's like poking me all the time. That's how I feel. And so, but not everybody is like that. So every
Mhm.
patient is different. You can have your skin dry, right? Your skin can completely dry out. You can look really dull and old.
Mhm. Mhm.
And when I start treating patients, they become life again, like the life comes back again. Their skin starts glowing. And that's one of the things I look for. When the
Oh.
patients come back, I'm looking at their skin and then looking at the hair. Is it shiny? Is it what's happening with the skin is getting clearer?
Mhm.
Right? So those things happen automatically once you start working with the patient with functional medicine, which includes the bioidentical hormones.
Wow. Okay. Um, and I think I mentioned like dry eye earlier because that's
Yeah.
why I have my glasses on. Dry eye is a symptom.
Yeah, it's dry. So everything gets dried out. If you really look at it, the old age and aging is just drying off of the body. You can't even if you drink so much water, you can't hold on to the water. The
Right.
skin is really still dry no matter how much you drink. So it's not just the drinking, I think it's the rest of it
Mhm.
that needs to be balanced out.
Okay. And of course, we're and everybody, if you have questions, make sure to get them in because we've got just a little bit of time left. But I wanted to touch on this quickly. But and so how can women, I guess, and men remain sexually healthy and maintain intimacy when they're like for women there's the dryness and then maybe for both the reduced libido. Actually, I don't know if that happens for men, but for women it does.
Well, in men, it only happens later. It's not
Yeah.
as early as 50. In men, usually at 60 and older.
Hmm.
So men experience the same problems, but a little bit later because it's more gradual declining of the hormones. In
Hmm.
women, it's very dramatic because it's from one cycle to the next. They have no hormones, so it's very dramatic. It comes very fast, and so there is an issue. Yes, so that's very common. It's very common. Issues with intimacy and dryness and painful intercourse. All these things happen because of the vaginal dryness,
Hmm.
so we do help with that 100%. It's very simple. And we want to get the vaginal mucosa rehabilitated, like really help that mucosa to be more moist, more, it's not dry. That's what we are trying to do. So
Hmm.
we do use estrogen. So the estrogen replenishes the vaginal mucosa and it actually becomes more normal. So then
Hmm.
you can have normal lubrication. So it's very common. I mean, I see that all the time. So it's, and the libido problem, that's, again, that's, also because of the low hormones. So
Hmm.
progesterone deficiency will cause low libido. So you can test that out, see if that helps you, because progesterone does convert into testosterone in women. So you can see if you balance out your progesterone, you're killing two birds with the same stone. So you're getting progesterone and then you're getting the progesterone converted into testosterone. So it might be a good solution for some patients.
Okay. And for my last question, well, actually, there looks like there's a couple questions. I'm going to jump to the comments because there's like two people asking. They want to know the name of your practice and where you're located.
Yeah, of course. So we are called Angel Longevity Medical Center, and we are located in Studio City, California.
Okay. And someone else was asking, can one use DHEA in perimenopause? And if so, why? Or if not, why not?
Yeah, absolutely. Again, so you can, all the hormone decline with menopause. So
Hmm.
you want to see which patient has what deficiency. It could be varied. So somebody could have low DHEA, so they're going to need DHEA. Now you don't want to take DHEA if your DHEA is normal or optimal. So it's not like everybody should take DHEA. No, it depends on what is your DHEA levels. So if your DHEA levels are low, absolutely you should take DHEA. And it's a good hormone because it does downstream metabolites of DHEA are testosterone, and it is, it can convert into actually any of the hormones. So you have a good chance of replenishing other hormones as well. So it's not a bad thing to do. Sometimes the DHEA can cause skin breakouts. So you have to kind of see if it's affecting you with that or not. If not, then you're good. So yeah, absolutely.
Okay. And the last question, how can women and men navigate these conversations with their doctors to make sure that they're getting the best treatment and the best care for their unique, symptoms, their body? Like what advice do you have for us as we go to our doctors and say, Dr. Matur said?
Well, unfortunately, at this point in time, the best bet that you have is to see a doctor who specializes in
Mhm.
BHRT, because
Okay.
not only that, okay, so sometimes you can get prescriptions from your gynecologist or your urologist if you're a guy, for the hormones. But problem with that scene is that there is also needs to be a monitoring. So it's
Yeah.
not enough to take hormone, it's also to see, okay, is this the right amount, is the right dose, is it converting properly to the other hormones, is
Mhm.
it increasing my risk of cancer or is it decreasing my risk of cancer? So those are the things that a doctor who specializes in BHRT can address.
Mhm.
But the other mainstream doctors are not trained into that, unless they decide to get trained, great, like I did. So there is doctors that are trained, and those are the people that I think you will be best. The best bet is to see a doctor who specializes in the bioidentical hormone replacement.
Okay. Well, thank you so much. This has been great. Like, I'm so glad that you came back to talk to us about the symptoms and dig more into the hot flashes and night sweats. This was a great conversation. So you've got to come back, and we'll do another take on menopause at some point. And again, let everybody know the name of your practice again, just in case they missed it.
For sure, it's Angel Longevity Medical Center in Studio City, California.
Okay, thank you.
You're very
Every
welcome.
For more information on menopause, head over to blackdoctor.org. There's a ton of articles and resources there. And as for me, I will see you guys next week for a celebration. We're going to continue the conversation on Breast Cancer Awareness Month. And Ananda Lewis is joining me. Y'all know her from Teen Summit and MTV, BJ, her talk show. So she's going to be here chatting with me on Soulibration. So make sure you tune in. And I want everyone to have a soul filled rest of the week and be safe. Thank you, Dr. Matur.
Thank you very much for having me.
Thank you.
Okay, bye bye.
Bye, everyone.